This is Mission Critical to Mission Accomplished. Tune in to Constant Technologies podcast, where we keep up with the latest in Operations Center technology and applications.
I feel the liftoff. The clock has started.
Hello, everyone. Welcome to another episode of Mission Critical to Mission Accomplished, a Constant Technologies podcast. I'm your host, Daniel Litwin, the voice of B2B. Folks, thank you so much for joining us on another episode of Mission Critical to Mission Accomplished. We always enjoy getting you fresh content, and of course, we're not going to stop, even with a pandemic rocking the world and rocking every other industry. So as things continue to update several of our industries, of course, we're going to continue to do interviews on the intersections of different issues and different innovations and technologies. So if you'd like to listen to those conversations, make sure you're subscribing to the podcast on Apple Podcasts and Spotify, and make sure you're going to our website at constanttech.com. Again, constanttech.com to get more information on podcasts, articles, videos that we've produced, as well as info on our solutions and services. Speaking of COVID, it has obviously been a true test of our healthcare professionals' infrastructure, national model, and funding strategy for healthcare in general. And even though it has revealed many inefficiencies and given inspiration to new strategies for preparing ourselves as a nation for unprecedented viral disaster, in the short term, it has also revealed how critical simple efficiency, logistics, oversight, and management are to handle the fluctuation of patients, PPE, and hospital security. So for that reason, we're taking today's episode to highlight the utility of healthcare command centers and their impact on COVID-19 response. For insights, we're joined by Gip Sisson, Senior Project Manager for Constant Technologies. Gip, great to have you on for another command center conversation. How are you doing today?
I'm doing great, and thank you for having me.
Absolutely. Looking forward to our breakdown of this intersection between the command center world and healthcare and COVID-19. So let's start by reviewing the current struggle of healthcare professionals, just to set the context. What are some of the most critical challenges that hospitals are facing during COVID today?
Sure. As hospitals, are rising to meet these challenges of COVID-19, the virus and its effect on the nation really have created a historic financial pressure for America's hospitals and, the overall health systems. Hospitals, are set to lose over $202 billion from March through June of this year due to the pandemic. And due to the pandemic, the healthcare sector also lost over, almost 1.5 million jobs just in that time frame. So hospitals, because of this, pandemic, have had to cancel non-emergency procedures, and Americans are postponing care as a shelter in place to help try to stop the virus. And also treatment for COVID-19 has created an incredible demand for certain medical equipment and supplies as the virus has disrupted supply chains and increased the cost the hospitals have to face to treat those COVID-19 patients. So at the same time, COVID-19 has unprecedented job losses, leading into a rise in number of uninsured people having a hard time paying for the care that they are getting. So at the end of the day, it comes down to dollars and cents and the fact that hospitals are struggling to survive right now.
Of the challenges you just broke down, which of them are felt even outside of a pandemic? And what do you think this has to say about areas where hospitals could use the most critical oversight and support?
Well, hospitals are always operating on a low margin, so efficiency is key. And if we can streamline the entire hospital process, then we should be able to create more revenue for the hospital. So for example, if we create tools that will help them track a patient from the time they check in to the time they check out, and doing that by knowing where that patient is at all times, predicting where they will be going in an hour, 6 hours, or 12 hours, then they should be able to predictably schedule rooms in advance and resources accordingly. If we can do that, then with all of the patients in a hospital, coinciding with even all of the equipment in the hospital on where it is and where it needs to go, then the entire hospital should run at a whole new level of efficiency. This new level of care typically leads to scheduling more appointments, more surgeries, so on and so forth, which, at the end of the day equates to more revenue. So this new model is sort of a hub and spoke is how they're referring to it, where the hub is the central command center and the decision makers on where the resources in the hospital need to go. For example, if you were to have your bed placement team sitting next to your transport team and sitting along with even people from monitoring the helicopter pad, all of that working together combined with all this information in front of them in a central place, that communication across the board gets streamlined and everything gets faster and more efficient. So the hub is the crucial part of this, and providing the tools to do that in a new way with technology is something that is really working out well for the hospitals.
So, how common are command centers as a solution then in healthcare today? Are they a staple, or do you still see them as margins of the industry?
Really, I think there's still margins in the industry. The new technological command centers that we're building are fairly a new concept, right? There's been sort of archaic systems in the dungeons of these hospitals that are monitoring things in an archaic way. But there's so much that can be monitored electronically in a hospital setting and environment that it just makes sense that a large video wall and a central place to view it really will provide, some great feedback at the end of the day for the hospital. So right now we're monitoring a lot of operational needs in a hospital. All new dashboards and software tools are being created every day, and this helps to adapt to the hospital's needs and help them think through and how they're going to make the entire process more streamlined and more profitable. Also, bringing in multiple teams into one room for hospitals is sort of a new concept for them. And, certainly, as I mentioned, allowing better communication and workflow and faster decision making. So, in all, the entire hospital process has really improved with these command centers.
When we get into the specifics, how exactly can a command center support some of the most critical care and logistics bottlenecks for a hospital?
So, as I mentioned before, this hub and spoke idea and providing a central location with all of the information in front of these work groups allow the staff to see the entire overview of the hospital in real time. Basically, the central location allows for, again, better communication and faster decision making, and using predictive type software by the information that's getting fed into the hospital system. They can see the hospital needs and project it out 1 hour, 1 day, or 1 week in advance. And this is something that, again, improves the hospital's efficiency. So the key is to spot the potential bottlenecks before they happen, and providing them the tools and resources they need in order to be able to do that is something that Constant has taken some pride in and has enjoyed working on these projects.
Yeah, I'm glad you brought up Constant Tech because I want to highlight as well some of the unique ways that Constant Tech is bringing command centers to the healthcare space. Can you give us some context on what you're doing that is unique or different in the space and how that's impacting the different healthcare organizations that you are delivering these command center solutions to?
Sure. So we are, different than your run-of-the-mill furniture provider or AV solution company. We're really the only true turnkey provider in the industry. So, when I say turnkey, I mean we are looking at the project from, a consultant's point of view and sitting down with the stakeholders to understand the workflow. From there, we're the spatial designer of the room. We also are the integrator. We're the manufacturer of the furniture that we put in our installations. And we're also the, programming and whole integrated package on the AV side of things as well. So you can see we're there from soup to nuts, from the start of the project to the end. We're installing it with our team. We're not subbing any of that contract work out. We really take pride of grabbing that entire project and running with it with one central place to call for these stakeholders to come to when they need a solution for a command center. We really like to look at the whole function of the command center and how the space will be utilized. And using our 30 plus years of experience in the industry, we are taking a look at it at a big picture and then bringing it down and working through the micromanagement portion of the project. So everything from who needs to be in the room, where they need to sit, what kind of information they're looking at, how much information they need to look at, which transforms to, okay, the space they have, what's the ceiling height, how many monitors and displays do they need, what kind of infrastructure do they have from the power, heating, cooling side, is it a raised floor environment or not. So we take a lot of the pieces to the puzzle that happens behind the scenes that we already know and have and can present and bring to the team as part of the project process. So we're basically taking all our 30 years of experience of our command center spaces and now moving them into this healthcare industry that never really had them before. And that is proving its weight for our clients because they're have one phone call to help them through all of this. And, we might be working alongside an architect that they have, or maybe a contractor that they're using. But at the end of the day, we're really providing our valuable insight and knowledge in the command center industry to help these projects get off the ground and moving forward.
And finally here, Gip, what do you imagine is in store moving forward for the healthcare industry and command centers as a logistics and efficiency solution? Do you imagine it's going to continue to proliferate because of COVID and because of varying stressors on the industry? Do you think it's going to take a little more education? What's your outlook?
Well, I think at any time you can prove that the efficiency gained through a command center results in a better bottom line, a hospital is going to take a strong look at that. So in that sense, I think that these command centers are going to continue to catch on. From a patient perspective, if you can imagine yourself going to an ER or having a procedure done and you're getting in and out of the hospital faster, we all want that at the end of the day as well. So it's sort of a win-win for the hospital. It's a win-win for the patients and, hopefully for the healthcare workers themselves and being able to have the right equipment at the right time. So not only from an operational standpoint, where these hospitals are sort of now in their monitoring and the way they're using their command centers, but forward thinking from here as these catch on, I can see them, moving into the direction of having a central command center space for surgeries and having a place for, oversight of those surgeries, either by other doctors or students in a place in smaller breakout rooms and sessions. So that kind of forward thinking is where I think the command center industry is heading in the command center field or environment in the healthcare sector. But, right now it's sort of got locked in on operations and that's working really well. And, sort of the sky's the limit on branching out from there on how we can, better improve the whole hospital environment and workflow and efficiency. So there's certainly room for more growth. However, right now it's from the feedback we're getting, been very well received in the command center world.
All right, Gip Sisson, thank you so much for joining us. This is Mission Critical to Mission Accomplished. Tune in to Constant Technologies podcast, where we keep up with the latest in operations center technology and applications.
I feel the liftoff. The clock has started.
Hello, everyone. Welcome to another episode of Mission Critical to Mission Accomplished, a Constant Technologies podcast. I'm your host, Daniel Litwin, the voice of B2B. Folks, thank you so much for joining us on another episode of Mission Critical to Mission Accomplished. We always enjoy getting you fresh content, and of course, we're not going to stop, even with a pandemic rocking the world and rocking every other industry. So as things continue to update several of our industries, of course, we're going to continue to do interviews on the intersections of different issues and different innovations and technologies. So if you'd like to listen to those conversations, make sure you're subscribing to the podcast on Apple Podcasts and Spotify, and make sure you're going to our website at constanttech.com. Again, constanttech.com to get more information on podcasts, articles, videos that we've produced, as well as info on our solutions and services. Speaking of COVID, it has obviously been a true test of our healthcare professionals' infrastructure, national model, and funding strategy for healthcare in general. And even though it has revealed many inefficiencies and given inspiration to new strategies for preparing ourselves as a nation for unprecedented viral disaster, in the short term, it has also revealed how critical simple efficiency, logistics, oversight and management are to handle the fluctuation of patients,